Hello everyone, this is FEYA team. I'm Robert Solomon. I will present you our project, FEYA Maternal Healthcare Project, which aims to bring accessible maternal healthcare to rural Ethiopia. Our team members are Amy Sawaka, Yomoti, Mazgawa Waidu, Hassan Shayalo, and me, Robert Solomon, and Umi Abdul Nasser. So continuing to the next slide, project overview. We'll be covering on this presentation project objectives and goals, understanding maternal health challenges, proposed solutions for improvement, key facts and statistics, recommendation, and next steps. So going to the main thing that initiated that to start this project, the problem. The main cause was limited access to care. In rural areas, there is lack of accessible and sustainable maternal health care. Severely, this impacts underserved rural communities in Ethiopia. Also, there is high maternal mortality rates. Ethiopia faces significant challenges in maternal deaths during childbirth and as well during pregnancy. Rural Ethiopia faces preventable risks due to long distance healthcare facilities, inadequate medical infrastructure, shortage of skilled professionals without timely access to care, and maternal and child mortality remain unacceptably high. So, how does our problem align to the GCGO? The problem or issue we mentioned aligns with global change in the healthcare, and as well the global opportunity women empowerment. Let's look on our impact persona, Salamahit, an expectant mother who is 26-year-old in rural Oromia, must walk over 3 hours to reach the nearest clinic with no reliable transport or digital tools. She often misses her prenatal or antenatal checkups and struggles to get urgent medical advice. This impacts her in a way that delays her to access care, putting her and her baby at risk of complications that could otherwise be prevented with timely guidance and teleconsultation. Looking on to the facts, as you could see, Ethiopia has about 70% of population on the rural areas, but mostly the healthcare is more abundant on the urban regions. You could see from the graphical representations that the spatial distribution shows that in areas where spotted red, there are rare or inadequate healthcare facilities. This implies that in rural areas there is less healthcare facility for mothers, specifically for female use. Continuing to the next fact, about 3 out of 5 women in rural area receive adequate care. That's about 60%. So the rest 40% doesn't get adequate health care. 25% or quarter of women has access to healthcare facilities that are with good quality. Also, there are only 1,200 clinics that aim to serve this maternal health care. Let's look on the fact that what if this problem got solved? If a mother gets early care, 8 out of 10 mothers getting early care would tend to experience better healthcare outcomes and avoid complications. 95% of maternal deaths are preventable. So most of the diseases that occur in our country are preventable due to this and occur due to inadequate healthcare facilities. So it's recommended that there is 4 visits at least during her pregnancy. Mother should visit 4 times. Let's look on the solution we proposed. So we proposed a simple mobile web application in local language designed for Ethiopian. So this will provide symptoms checklists and clear guidance on what to do during symptoms. This system will be enabling video calls with doctors for remote consultation. It will be integrating community associations like Kader and the COP to establish first level diagnosis center that these centers are equipped with telehealth and kits and smart device using any personal that's able there. This solution leverages existing cultural structures and technology to close the healthcare gap. So next, going to the visual representation of our solution. This app first. This is the first page of our app. Welcome page. As said before, the app will be having features like setting up appointments, symptoms, checklists, video calls for remote consultation. On the next page is the physical representation. This will be the video call feature that we'll be having. Also, there is community based dashboard. Now, next, let's see the pain points that the mothers have. So, there are 6 pain points that are mainly affecting the mothers. One of the main pain points is long distance healthcare. Pregnant women often travel hours to reach the skilled care. The other is missing the prenatal checkups, lack of reminders, leads to late or skipped visits. The other thing is high cost of maternal care. Many rural mothers cannot afford frequent hospital trips. The other thing is language and literacy barrier. Women often struggle to understand medical advice since it's not delivered in their local language. The other issue they would be facing is delay response to symptoms. Complications worsen without timely communication with the health professionals. One other challenge they would be having is tech adoption. Some users rely on community facilitators for app usage, and our solution would be aiming to solve these pain points of our user. So, what are the recommendations based on the feedback we've got and constraints? So, the first recommendation would be having is protecting maternal health data. Health data is mostly is considered sensitive and kept secret. So we'll be implementing end-to-end encryption, strict access control, anonymization, secure sensitive pregnancy information. Also, we'll be simplifying the app interface for the ease of use, using visual icons, voice guidance, native language to overcome literacy barriers. Also, one issue is connectivity. We'll try to address this through using offline capabilities at community access points and enable SMS or IVR-based consultation to reduce reliance on continuous internet. The other recommendation we have is leveraging community networks. As we have seen, there is communities in rural areas like Kovarodo. We will be training local health workers there, and plus association leaders or of the group to assist mothers with the telemedicine use. The other recommendation we have is assumption check. We assume the pregnant woman and the facilitators are willing and able to use mobile phones to access the telemedicine. Continuing to the next slide. So what are the next steps at funding visits? So on our phase 1, 0 to 3 months, we aim to register about 500 plus pregnant women on our FEYA platform, complete 300 successful remote telemedicine consultations, deliver 90% timely health alerts, and on phase 2 aim for which will be 3 to 9 months from now. FEYA will be scaling to 5 rural districts with community-based diagnosis centers, training and onboard local facilitators and health workers to support the users, establish partnership with health bureaus, NGOs, and telecom operators. And on phase 3, which will be 9 to 8 months, integrate AI power to the maternal risk prediction tools to detect high-risk cases early, expand FEYA platform with multilingual support and offline capabilities like SMS and IVR, build a sustainable model through government adoption and donor funding. Or, so why does FEYA matter? FEYA aims to bridge the healthcare gap in rural Ethiopia, empowering women with life-saving maternal health information in their own language, strengthens communities by linking local associations like a local with healthcare access, helps prevent avoidable maternal deaths through early detection and timely care. Our vision with FEYA, no mother would be left behind. Thank you. And if you have any questions, put down it on the comments or contact us if you could. Thank you.